Yeah, it's ready. We can crop it out. It's fine.
Okay.
Go.
My name is Michelle. I'm a nursing student, and I'm going to check the doctor's orders. So this is Carla Campanos, and she is struggling with feeding since birth. She'll need a feeding tube placed. So we will be putting in a nasogastric tube to ensure proper nutrition. Okay?
Mm-hmm.
Let's meet our patient.
Okay.
Okay. Hello, Carla's mom. My name is Michelle. I'll be your nursing student today. We are going to insert a NG tube via doctor's orders. Do you know what an NG tube is? No? Okay, so an NG tube is a tube that goes from your nose to your stomach just to deliver the proper amount of nutrients and, in some cases, medications to the stomach right away. So I will start by taking a look at Carla here and just make sure she's good to go for the procedure. Filter needle. So, we're just going to check her name band, make sure everything checks out there. Okay, Carla, date of birth is November 25th, 2021, and that checks out with our MAR here as well. That is perfect. Okay. So another thing that we're going to do is check for allergies. Does she have any allergies that you know of? No? And there's nothing in the documentation of the MAR that says so either. So before we begin, do you have any questions about how this is going to go? So we're going to put a tube just down the throat. It's a little uncomfortable and it may be a little frightening for the baby. So we like for parents to hold the infant if possible. In this case, she'll just be laying there by herself and we'll assist her through that process as well. And then after the procedure's done, she shouldn't be in any discomfort. She might even forget that it's even there. So that's our hope as well. Okay, so I'm just going to check the patency of her nares. I just need some gloves. Just one moment. Changing it once a shift. Okay. So I'm just going to start by looking at her stomach. Just make sure that there's no abdominal bloating or swelling on either side. Everything looks up to date and good. And then we're just going to assess for patency on each side of the nair. And it looks like we'll use this side, so we'll have to move. Okay. Okay. So now we're going to put her in semi-Fowler's position and check for measurement.
And in my bedroom, I would have a sink, so that's where I would be doing this in this scenario. I do not, so that's okay.
Okay, so we're going from the edge of the mirror to the earlobe.
I'm just gonna put this straight in my sharps thing.
And down between the xiphoid process and the umbilicus. Alright, I'm going to mark that with a pen.
Alright, so now what I'm gonna do is get my independent double check from a second nurse. So I'm gonna take with me my order,
Excellent.
the med, and the file. So if I could get your check here. Perfect. Alright.
Okay. So we're just going to drape our
Alrighty.
patient here, wrap
So now I'm going to head to the patient's room.
tight
and
so
what
she
I
doesn't
have
move
with
during
me
the
here is
procedure.
To take baby's temperature, and then I do his vitals. I have the supplies I will need, including my
And
vitamin
I'm just going to clean the
And I will
area.
also take with me my order so I can check my patient identifiers. Also gloves because baby's 3 hours old and will not have had
Excellent.
a bath yet. Alright. Okay.
Okay.
Knock, knock, knock.
And at a certain point, I will insert this just to help the tube move along a lot faster and easier.
So, Mom, we're just
Okay.
gonna start by getting some.
So we're going to go in here.
There we go.
Just get my supplies.
That's okay.
Okay.
So my name is Laura, and
So we will begin the procedure now. Oh, I forgot some lube.
Vitamin K injection.
So if I had
Anybody
lube,
talk to you about what vitamin K is?
I will put that on now.
No, not yet. Okay, so vitamin K.
And we've got lube
exactly that. It's his,
on the
vitamin
tip there
K, pure vitamin
for
K
insertion.
And we give this to babies because when babies are born, they don't have very much vitamin K in their body because it doesn't cross the placenta well to have a lot of
Okay.
vitamin.
And then we're just going to put this in there and encourage the baby to suck.
So because baby's been just putting pressure on the pelvis for so long, right? His head's a little swollen there. We don't want any bleeding.
Okay.
So we give them this shot just to help their blood clot and yeah. Does that make sense? Yes. And you're okay with me giving that medication? Absolutely. Alright, so what we're going to do is we are
So we're going to anchor this in place.
Carter's identification here. Could I have you please tell me is
And we're going to check that the tube is in the correct position. And by doing this, we're going to look at these contents, the color, the appearance, and the pH.
I'm going to begin with doing my assessment. We're going to do the vitamin K afterwards, just because that's the roughest part for babies, right? So some gloves here.
All right.
Alright. And you're holding him? You're good holding him right there. Alright.
Perfect. So I'm going to.
Make your arms a bit.
So we have yellow, cloudy stomach contents. And we're just going to drop a pH there.
If there's something that can be a sign of dehydration, if they're bulging, it's a sign of overhydration.
All right, so we are at about a 3, so that's perfect. Anything 4 and under indicates that
Now while he's quiet,
there is stomach contacts according to the acidity. Okay. So we'll actually be securing this properly with Tegaderm as well.
just bring your back a little bit here, Mom, okay? 'Cause I'm freakishly tall. This is a slow one. And how's the feeding going with Carter? Is that going good for you? Yeah? So you feel comfortable watching him by yourself? Just flip there. Perfect. Okay.
Oh my goodness.
Alright. And he last fed, oh, he just ended, stop feeding half an hour? Okay, half an hour ago. Alright, so we're gonna start.
Okay. So now that the tube is in the correct position, just some teaching points. So we're going to encourage a lot of oral hygiene. If the black mark on the tube moves around, if it's a little bit further out or if you can't see it anymore, it could indicate that it's in the wrong place and that we might need to move it. Just going to put these contents back in. Any questions?